You're listening to the Sick and Good podcast. My name is Dustin Messick, RDN. I'm a cancer survivor.
My name is Dr. Colin Goodwin, and I'm a cancer survivor. We're discussing topics related to cancer treatment and recovery while promoting wellness.
To find a balance between sick and good.
And during the cancer process, both can be true.
The Sick and Good podcast is for educational purposes only. The podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or treatment, and before undertaking a new healthcare regimen.
Welcome to the Sick and Good podcast. Joining the conversation today is Dr. Mary Byron Nelson, who for many years was a nurse practitioner at the Children's Hospital of LA in the Department of Hematology and Oncology. She worked in the Survivorship Late Effects Clinic with working on research of pediatric brain tumors, and did her research in the field of mechanisms of brain injury from childhood cancer treatment through neuroimaging and including neurocognitive, the psychosocial late effects and development of interventions. Currently, she is the Assistant Professor of Pediatrics at the USC Keck Medical School and has had that position for the last 3 years. So just wanted to welcome Mary to the conversation.
Thank you for having me.
It's a pleasure. Wanted to ask, what brought you into the field?
Well, let's see. I've always been interested in the brain from the time I first started off as a bedside nurse. I worked on the neuroscience floor at Children's Hospital in Boston, and we had a lot of children on our unit who had brain tumors. And I just became so fascinated by that kind of the disease process and taking care of those children. It was an opportunity to really become very involved with them and take care of them over a long period of time. And I just developed a love really for the brain then. And so I pretty much have stuck with on pediatric oncology and most specifically neuro-oncology for the many remaining years of my career for the most part.
Can you tell us a little bit about your research?
Sure. So one thing that I really noticed that sort of bothered me quite a bit when I was taking care of survivors of pediatric brain tumors was that we know that those children who survive brain tumors, they have kind of often have a poorer quality of life than children who survive other types of cancer. And a part of that is due to the physical challenges that they might have from having had a mass in their brain, but also from the cognitive effects that having had a brain tumor can result in. And so I wanted to try to figure out on a deeper level what exactly was happening to their brain as a result of cancer treatment, and if there was anything that we might be able to do as some kind of intervention to be able to kind of mitigate those effects of chemotherapy and radiation on the brain. So my studies have really sought to determine whether there's a difference in children who are treated with surgery alone versus surgery and chemotherapy versus surgery and chemotherapy and radiation, which is kind of the cornerstone of pediatric brain tumor therapy for the most part. And so we do use, as you said, we use neuroimaging, neuropsychological assessment, and quality of life assessment tools to kind of try to determine those differences.
What have you noticed are the biggest differences between those treatments that you just listed?
Well, kind of surprisingly, in my study, we found that just purely having a brain tumor alone can have sometimes significant effects on a child's future ability to learn and to remember and to be able to process information. And that it isn't necessarily a cumulative effect of treatment. So, for example, we've always known that radiation therapy to the child's brain can be quite harmful to the normal parts of the brain as well as to the brain tumor itself. And so we've learned so much in the past few decades about how much radiation therapy we need to give in order to cure cancer and how much we should give to enable us to cure the cancer, but also to have the child have the fewest amount of long-term effects as a result of the radiation. And so in my studies, it hasn't always shown that children who received radiation have the most serious effects of treatment. Sometimes in one of my studies, we've shown that it's actually children who were treated with chemotherapy, but not with radiation, who seem to have a bit more difficulty with their memory, specifically their long-term memory, than the children who got radiation as part of their treatment. And I think some of this has to do with the age that children were when they were treated. So the children in our chemotherapy treatment group were younger when they were diagnosed, and that's actually why they didn't receive radiation as part of their treatment. And they do seem to have a bit more difficulty with their memory than the older children who got radiation therapy in addition. So it shows us that there really is such a combination of factors that we have to take into consideration when we are trying to make sure that our children have the fewest late effects as possible.
Can you speak to the social effects of brain cancers?
Yes. So we do know also that brain tumors do have kind of a social effect on children as well, more than other cancers. And part of this is because of the fact that sometimes these children do have some learning problems. And when children have more learning problems and perhaps a bit lower IQ scores as a result of having had a brain tumor, we know that those children tend to have more difficulty in social situations. For example, they tend not to initiate conversations as much. And so they appear to be quieter and more withdrawn than some of their peers, which makes it difficult for them in social situations. Also, sometimes as a result of their treatment, they might be smaller than their peers because, for example, some brain tumor treatments can cause alterations in growth hormones. And so some children just don't gain as much height as their peers do. And so they might feel a bit different as well. So a combination of taking less initiative in social situations and then feeling that you might look a little bit different from some of your peers, I think makes it difficult for some of our children with brain tumors in social situations.
Can you tell us a little bit about your past role as a nurse practitioner?
Yes. So I really loved being a nurse practitioner. I worked actually in a few different settings. I worked for a time in the emergency department, which I found to be extremely stressful, and I didn't really like it very much. I think I'm not cut out for that kind of just very acute episodic care where you see a child who's very sick and try to help them, and then you never see them again and you never really know what happened. I really prefer to work in oncology where, as I said before, we have longer relationships with our patients. So I did work for a little bit in a leukemia program. So I really enjoyed that very much. I did that at City of Hope, which I really enjoyed working there for a while. But my love has really been in neuro-oncology. And so that's been the majority of what I've done. So taking care of children kind of throughout the journey of being diagnosed with a brain tumor, all the way through to hopefully long-term survival, but sometimes also to the very difficult outcome of, not surviving their tumor. And I have found that it just has been such an amazing experience to kind of be able to walk with families through that journey and hopefully to come out on the other side into survival, but sometimes not. And even to have just come to know so many incredibly brave and wonderful children, just always wise beyond their years. They always teach us, I think, so much about life and how to live it. And when I teach my medical students, I tell them that because people think that, well, pediatric oncology must be a difficult specialty. And it is a difficult specialty, obviously, because it's a life-threatening disease. But it's very gratifying and rewarding and humbling, really, to be able to be with families during that really difficult, challenging time. And I also really love working in survivorship because we get to see our patients who have survived their brain tumors and try to really help them to navigate their future so that they can have the best possible future for them and their families.
Can you tell us a little bit about that research in the survivorship clinic? I believe you said that maybe it's just looking at the late effects.
Yes. So I feel fortunate to have been working in survivorship during the time period that I did so, from really the late 1980s until just recently. And it wasn't really until around the late 1980s that we started to have such excellent survival percentages in childhood cancer that we were able to really notice and take a much deeper look at, okay, now that children were surviving cancers, what are some of these treatments that we're giving them to help them live? Like, what are they doing to them long term? Because we know that the treatments that we give for cancer are fairly toxic. And when we give them to children who are young and they're not fully grown and their brains are still growing and their bones and their organs and their spines are still lengthening and growing, some of the treatments that we give, specifically radiation, can be damaging to the developing tissues. And so during that time period of 1980s, 1990s, up until around, the turn of the century, we, and I don't mean myself, I mean the oncology community, made just incredible strides in working together to research the different effects of these treatments on every organ system in the body, from the brain to the heart, to the bones, to the lungs, just everything. And then worked even harder to tailor the kind of treatment that we gave so that we were giving the smallest possible doses of these chemotherapy agents and radiation to be able to cure the tumor, but to cause less side effects than we had been in the past. And so it was a very, very exciting time. And now we're also entering a very exciting time in cancer treatment where we're moving away from kind of a throw everything but the kitchen sink method of giving chemotherapy for cancer to much more tailored treatments that we're hoping will have far fewer long-term side effects in the future. So it's been a really exciting time to do this work.
When you talk about more like tailored approaches to treatment, are you referring to like immunology, or like what would be some examples of that?
Yes. So there are a few different examples. There is gene therapy, there are vaccines, which are part of immunotherapy, and there are targeted therapies. We've learned a lot about genetics, obviously, in the past couple of decades. And so now we've been able to figure out molecular subtypes, for example, of different types of tumors. In the brain tumor realm, for example, there was a tumor called medulloblastoma, and we used to think that was every child who had medulloblastoma, that was like the same tumor, and we treated it the same way in every child who had it. And then we realized, as we began to be able to do genetic testing on these tumors that there are actually 4 different types of medulloblastoma. One of those types has a better survival rate than the other 3. And so maybe those children don't need to get the same type of treatment because their tumors are actually different. And then we've also determined now we can figure out what kind of pathways to growth these tumors are using. I guess that doesn't sound so well the way I said it, but what are the sort of molecular pathways of growth that are leading to these tumors like continuing to grow and sort of metastasize? And by understanding what those pathways are, we now have targeted therapies that target those growth pathways. So when we have these medications, they just stop the growth pathway. And that's usually can occur without all these extra side effects that you think of with chemotherapy medications. For example, children don't lose their hair and they don't necessarily become very nauseous and have all the same side effects as they do from chemotherapy. So it's been amazing progress. And I think the whole future of cancer treatment is on the verge of changing.
Wow, that's like really fascinating. And it's great to hear that treatment it's becoming more individualized based upon all of the new forms that you were just talking about. And just to kind of switch gears a little bit, I wanted to ask, how do you approach wellness in your current role as like a nurse practitioner, as a professor?
For my students?
Anything that you would like to speak to on approaching wellness, however that applies to the roles that you've worked in.
Okay. So I think working in the survivorship clinic, we did definitely try to focus on wellness. Mm-hmm. We had a wonderful social worker who worked with us, and she was very much into mindfulness and meditation, yoga, and she really talked with our patients about that a lot, and their families, about learning how to do some type of mindfulness practice in your life to help to decrease stress and anxiety. She was just a huge promoter of that type of wellness for our families. And we also, I think, we try to practice that ourselves as well. Working in pediatric oncology can be very stressful, and it can be very sad, and it can weigh upon us. And I think that exercise is a huge component of wellness that I try to practice myself and that I recommend to my patients and their families. But also I think about my students now, where I'm teaching medical students. Their wellness is a big concern of mine, because we know that medical school is a very stressful undertaking. It takes years to get there, years of hard work and studying and preparing. And then when you do make it to medical school, it continues to be very stressful. You want to perform well. There's so much to learn. Can be very stressful. And so we do try to be very mindful, particularly I think at USC, of our students' wellness. We provide some time off for them whenever we can. We try to just limit their hours and, again, encourage them to have some type of mindfulness practice or exercise, and to really just be there for them and be open and let them know that they can always come to us and talk to us about anything that is on their mind. So I think that has changed a lot since, maybe, like, my husband is a physician, and when he was in medical school several decades ago, there wasn't any concern for anyone's wellness. Really, you just had to sort of struggle through it. And I'm glad that we're much more aware now of mental health. I still think we have a long way to go to destigmatize it, but I think that we've made a lot of progress, at least in our awareness, and trying to understand that everyone has struggles with anxiety and stress and mental health.
Yeah, that makes sense. Mindfulness is something that is more and more coming into different aspects of the healthcare system. And it's also great to hear that you have that kind of perspective from, knowing how it was for your husband during medical school. Now you're teaching students and encouraging like self-care and wellness. And just to kind of transition back to kind of what we were discussing a little bit earlier, I was curious, what are some of the long-term effects of like brain tumors or like any tissue that you have seen in your work?
So definitely the long-term effects of children who have brain tumor treatment are numerous. So I talked a little bit about how growth can be affected, physical growth, because of often children can develop a growth hormone deficiency. There can be visual problems that can happen as a result of a brain tumor, depending on where the tumor is. One of the most difficult long-term effects to talk about, I think, is the possibility that some types of chemotherapy and radiation therapy can actually cause a second cancer. And I think that's just a particularly awful thing to have to tell families and patients about, because it seems so incredibly unfair, although it is rare, but it is a late effect that can happen. Certain types of chemotherapy can cause some damage to the heart, which can be, a really difficult long-term effect to have to deal with, to the kidneys, to the liver, because the chemotherapy that we give is sort of processed and filtered through the liver and the kidneys. And so it can cause some damage there. Also, radiation can cause a decrease in the growth of certain tissues when you give it. So, for example, we used to give radiation to the kidney or to one side of the abdomen. It can sometimes cause a decrease in the growth of that side and then a scoliosis, because the spine sort of gets pulled over to the side that hasn't grown as well. And let me see, there are so many really that but not every child who has cancer will have all of those long-term effects. It's really specific to the treatment they got, to the kind of cancer that they had, and to how old they were when they were treated for cancer.
Yeah, I was going to ask about the screening process and really identifying some of those maybe neurocognitive issues. I wanted to see if you could speak to that.
Yes, thank you. So I think most major pediatric centers who treat childhood cancer, they do have neuropsychologists who work with them. And so it's really important for us to have children undergo a series of neuropsychological tests as soon as possible after they've been diagnosed, particularly with a brain tumor. So, for example, after children have that brain tumor removed and they're starting to feel better again, we usually will do neuropsychological testing on them. And the neuropsychological testing looks at the child's overall IQ. It also tests memory, processing speed, so the speed by which you're able to process information, executive functioning, or it's also known as like problem solving or decision making. It can test all those different aspects of learning. And so we usually will have children undergo that test before they get their treatment, and then when their treatment is finished, and then every few years after that. And the reason why that's so important is that our children most of them are still in school. And so we want to make sure that if they are having any difficulties that will interfere with their learning, that we pick those up as soon as possible, and that we work with the schools to make sure that the school knows about this and can provide an individualized educational program for each student so that they can have the best chance of success in school.
Yeah, that makes sense.
I'm wondering if there are particular late effects as far as like neurocognitive late effects that are more typical, other than the ones you just talked about, like as far as like the processing speed or problem solving and procedural memory. Just curious.
No, the one that comes to mind that I shouldn't have left out that I think is really important and can actually be very common is attention deficits. And I would say that attention deficit issues are very common in the general population, as I'm sure you know, but also they're very, very common after having had a brain tumor. And so many of our children who survive brain tumors do have difficulty maintaining and sustaining attention, which makes it very hard for them to learn.
That's really interesting. Something else I was just thinking about from this conversation and with all of the breakthroughs in your work is I'd like to hear maybe about some of like the really positive outcomes that you've experienced from working with children in this kind of work.
Oh my goodness, there are so many that will have to try to figure out how to say this. So I should start out by saying that even with all that we know about brain tumors and cancer and its treatment and what we think we should expect, every child is so individual that we never know. Actually, we can't really predict how well they will do. And I have to say, I've been so pleasantly surprised so many times by many of my patients who appear to be relatively unscathed by their experience with a brain tumor and its treatment. I can think of one, just specifically right off the top of my head, that's just a beautiful 6-year-old little boy who had a really difficult brain tumor that didn't have a very good prognosis. And he underwent very, very intensive treatment with chemotherapy, with actually a stem cell transplant and radiation therapy. And he is just an absolutely brilliant 12 or 13-year-old little boy right now. So he really, and I don't know why or how he didn't have a lot of these effects, but I think that he was a lucky little boy. Also, there have just been I don't know, it's just so gratifying to see families, I think, come together when their child has a life-threatening illness like this, and the way that they support each other and support their child. And it's been wonderful to see children come back teenagers and young adults come back for their survivorship visits, and they're in college. One of my all-time just most special patients in the world decided in his senior year of high school that he wanted to become a nurse. And I think that is one of the most gratifying things to see, is that a lot of our patients who survive their cancers, they do want to give back. I just think working with children as patients, I tell my medical students, they're much easier patients than adults because they don't take anything for granted, and they just incorporate this awful disease into their life. It's just like, okay, this is my life now, and I have to come to the hospital and I have to get through this. And they come out on the other side and they decide that they want to become a doctor or a nurse or a speech therapist or a child life specialist, and it just makes you think that we must have had some kind of a positive effect. At least we made it so their experience wasn't too terrible if they decided that they wanted to go into that field. I've seen that going through this cancer experience, which can be so incredibly challenging, it brings out the best in people. And I often think myself, like, if that happened to my child, I don't know that I could be so strong and look at the positive all the time. But again, it's just so gratifying to see children grow up. Honestly, I guess that's what I can say.
I appreciate you just being able to share that with us. I'm hearing that there's, and in your experience, a fair amount of these, well, I guess we can call them cases of children being able to have an acceptance more so than an adult of their cancer treatment and that struggle. And then also have that experience of the cancer treatment fuel an inspiration to then give back and to help others and to go into these fields that are going to make a difference in the cancer field. Listening to you talk about that, it just certainly made me smile, because that's something I strive for.
I know I'm preaching to the choir here.
Yeah, I think that also is a really good conclusion for our episode this evening. It's a positive note at the end.
Yeah, I had said to Dustin earlier that I was going to make a joke, but I'm like, yeah, it was one of those things where it was like a double Dutch. You were talking about just like how there's these late effects of radiation on just like cell growth. And I was going to make a joke that that's probably why I haven't been able to compete in the Mr. Universe. But it has nothing to do with the fact that I'm lazy or don't work out. It's simply just my treatment history.
Well, yeah, you'd have strong motivation, right? If you're never had treatment, you just be working out all the time, pre-cancer Colin.
No, it kind of reminds me of that joke. I think I said this to one of my oncologists that I'm like, will I be able to play piano? As he was talking about my treatment, it's like, sure. I'm like, well, that's interesting. Wasn't able to play piano before. Like, like it will give you abilities. Apparently, that's just pulling people's legs.
Well, I'm glad that your cancer treatment didn't interfere with your sense of humor.
That is, I guess, intact. Partially intact.
Our podcast will discuss topics related to cancer treatment and the recovery process, including diagnosis, family support, resources, medications, and nutrition. We aspire to have conversations pertinent and relevant to the cancer journey.
Thank you for listening to the Sick and Good podcast. We'd like to invite you to connect with us on our social media at Instagram and Facebook accounts. We're also happy to share that we have launched the Sick and Good podcast website, sickandgood.com. This website is a place to read our bios, subscribe to the podcast, listen to full episodes, or read full transcripts, and contact us with your questions or comments. We care about your listener experience and would love to hear from you to keep the conversation going on the topics of cancer and wellness.